CSU students were used as paramedics for these demonstrations. Hi there and welcome to this CSU skills video of how to perform a synchronised cardioversion. This video is a part of a series of skills videos designed for our paramedic course to assist teaching the practical skills components of our degree program. Today we're going to teach you about performing a synchronised cardioversion. You'll be able to apply this skill when you are practicing as a paramedic in the field. This video is broken down into steps so you can review it in your own time and take notes if you need to. Okay, so let's first look at the reasons why you would want to do a synchronised cardioversion in the field. You have diagnosed an unstable and severely compromised conscious ventricular tachycardia. You have diagnosed an unstable and severely compromised supraventricular tachycardia. You have diagnosed an uncontrolled and unstable atrial fibrillation. You have diagnosed an unstable and severely compromised atrial flutter. To warrant using this intervention, your patient must have cardiovascular compromise. This may present symptomatically as hypotension, syncope or a decreased level of consciousness, tachypnea, diaphoresis, chest pain or discomfort, poor perfusion as in their skin colour, pallor, clammy or grey. Remember, this list is not exclusive. There may be other reasons, such as the length of time the patient has possibly been presenting with one of these cardiac rhythms and they are symptomatic. The guideline to Cardiovert may vary with different health providers. Let's look at the steps to perform this skill. You will find the patient conscious, but if they are not, then they may be in cardiac arrest. You need to check your ABCs and reassess. You note on the monitor for this example that the patient is in VT. As a part of preparing the patient, you will first need to gain informed consent. So make sure you explain the procedure well. Let them know what you would like to do and why, and how this will be done. Lastly, ask permission for using this procedure. In some situations, the patient may have a decreased level of consciousness. In these cases, talk to the family members present and inform them that you'll be using this procedure, as you would have implied consent. Ask the patient to lie down flat preferably, or if this is too uncomfortable, you can sit them in a 45-degree angle. You'll need to expose the patient's chest. When doing this, you can maintain dignity by using a sheet to cover the upper portion of the body. You'll find most of the equipment you need should already be with the monitor. This is usually kept in the back or side pocket. A razor for shaving hair, some gauze for wiping the skin, and the electrodes plus some spare electrodes. It helps to attach the electrodes onto the leads first, as pressing these on afterwards can be quite awkward. Make sure they're soft and not hard or dried out. Turn on your monitor. This machine is a LifePak 15, but we also use several others in the ambulance services, including LifePak 12s and the Philips MRX. You'll need to become familiar with how to put this into the correct mode for monitoring and the mode for cardioversion. You may need to prepare the skin first by either wiping it with some gauze or shaving it to allow better contact for the electrodes. You won't get a very good reading if you attach the electrodes on wet or hairy skin. In this step, we will show you the two various placements for synchronised cardioversion. This video will not tell you when to do them, but merely explains the process. You will learn the when to in your tutorials. We're going to cover synchronised cardioversion only. This is one way of attaching the defibrillator pads to the anterior chest wall. Place the negative pad onto the right shoulder and the positive pad onto the left anterior chest wall, making sure that the pads are correctly adhered to the skin surface. If the patient has a lot of hair, you'll not get good adhesion to the skin. Shaving may be required. An alternative placement can be to place the negative pad onto the left anterior chest wall and the positive pad onto the back, below the left scapula and to the left of the spine. This may be difficult if your patient is obese and difficult to move. The limb leads can be placed anywhere on the limbs, but try to avoid bony prominences or large muscles, as these can cause interference. Limb leads should not be placed on the torso, as they are designed to be used on the limb. The critical process here is making sure the pads are adhered to the skin correctly. Be careful to handle the patient correctly, and at all times explain to them what is happening. Remember that this may be a frightening time for them, and clear communication with the patient is paramount. Connect the cables to the machine. Turn on the defibrillator. You can see the startup screen here for the LifePack 15. Push the lead button and use the black scroll button to highlight pads. Push the scroll button to confirm your choice. You will then see the rhythm displayed on the monitor. In this case, it is ventricular tachycardia. Remember that your patient may be fully conscious. You should be explaining the process and gaining consent for the procedure. If you have a fully conscious patient with a high GCS score, the patient may need to be sedated to perform cardioversion. This would require you to call for an intensive care paramedic to provide sedation. Most services utilise fentanyl or morphine or midazolam to facilitate sedation. As a practicing paramedic, you are not usually authorised to administer these treatments. The intensive care paramedic will decide on which medication to use and how much, depending on the patient's predisposing history, their comorbidities and any treatment which have been carried out prior to cardioversion. Note that not all service providers will allow paramedics to cardiovert, and this may be relevant to the service which you work for. Some services allow paramedics to cardiovert only when the patient has a lowered motor score component of their GCS. You are now ready to start. Push the Synchronised button. Check that you have small green triangles showing up on the R wave of every QRS complex. This shows that you have capture of the QRS. Use the Energy Select button to choose the correct joule setting for your patient or service guidelines. In this case, we're using 100 joules. Keep pushing the button until 100 joules is displayed on the screen. To confirm your joule settings, press the speed dial knob once only. Press the charge button and ask your crew partner and any other bystanders to stand away from the patient. You could utilise the stand clear prompt here. Explain that you'll be using a low energy supply on the patient, and this could be harmful to the bystanders. Once you've confirmed that nobody is touching the patient, you can deliver the shock. Quickly explain to the patient that this may be an unpleasant sensation. Press the shock button to deliver the charge to the patient. Check the screen to see what rhythm your patient is now in. If the patient has returned to a more regular rhythm or a perfusing rhythm, then you can continue with any other treatment required. If the cardioversion was not successful and your patient is still in VT or any other poorly perfusing rhythm, you may need to perform another cardioversion. EMOTS provider guidelines may differ on how many cardioversions you can do and what joule setting. Check the monitor screen to see if you still have capture. You may need to press the sync button again if no capture triangles are present on the R waves. You can then press the Energy Select button and change the joule settings to 150 joules. Push the speed dial knob to confirm your joule setting. Remember that your patient may be fully conscious or semi-conscious and able to hear you. Explain to them what is going on and that the first cardioversion was unsuccessful. You can now go ahead and press the charge button. You then need to check that no other person is touching the patient. You could utilise the stand clear prompt here. Once you're certain the patient is clear, then you can deliver the second shock at 150 joules by pressing the shot button to discharge the energy. Here we've been talking about VT only, but we will show you on the screen the other rhythms that you may encounter. Here is an SVT or supraventricular tachycardia. Here is a supraventricular tachycardia, which you might see in a paediatric patient. And here is atrial fibrillation. These are all rhythms that could possibly be treated with synchronised cardioversion. Remembering that this is only in the case of unstable and severely compromised patients. So let's just go back through the steps again. You have a patient who is in a rhythm which will benefit from cardioversion. They are not in cardiac arrest. You explain the procedure to the patient, you gain consent from the patient, you check pad placement and a full lead placement. Turn the machine to paddles through the lead button, press the sync button and choose the desired energy level. Charge the machine, confirm everybody is clear deliver the shock, check the rhythm, and check the patient. Thank you for watching our skills video on how to perform a synchronized cardioversion.